All right, welcome everyone to this Tea with an SME session on disability inclusive education. My name is Laura Parrott and I'm an education specialist at USAID Nepal. And my co-facilitator today is Odala Banda. So Odala, why don't you go ahead and introduce yourself?
Thanks, Laura. My name is Odala Banda. I'm Senior Education Specialist for USAID Malawi. I manage reading for all Malawi and assess the learners project in Malawi. I'm happy to be with you today. I will ensure that you are comfortably navigating through various features of Google Meet, that is webcam, microphone, chat window, as well as the automatic captions. Right now, I would like to request you to mute your microphone as well as turn off your webcams for the smooth running of the platform, and this will help us reduce unnecessary distractions. Secondly, I will request you all to open the chat window at the top right corner of your screen and answer the following question. From where in the world are you joining us today? I'll give you a few seconds to respond. Thanks a lot. I could see a couple of participants from Malawi, from US, from Nepal, from Ethiopia, and many other countries, Rwanda. Welcome on board. Once again, feel free to participate in this global education link series where we're talking about disability inclusive education, successes and lessons learned, perspectives from Malawi and Nepal. We'll take you through the social model of inclusive education, as well as the key ingredients of inclusive education, and then we'll jump into question and answer session. So I'll pass on the floor to Laura to kickstart the presentation. Over to you, Laura.
Thanks so much, Odala. Also, if at any point during our Google Meet today you experience technical difficulties, please email both Gina Fu at gfu@trg-inc.com and Jacole Douglas at jldouglas@umass.edu. And we'll pop those email addresses into the chat box. And also just to add on, this webinar will hopefully be consists of a presentation of about 15 minutes and then about 35 to 40 minutes of Q&A and dialogue. So hopefully we can have a really interactive discussion here today. So without further ado, let's dive in, and feel free to type questions and comments in the chat box as we go. So next slide. Perfect. So a number of you already on the call may be familiar with the social model of disability, but we're just going to do a brief overview here. So the social model of disability suggests or asserts that disability is a social construct. In the social model of disability, the model which guides USAID inclusive education programming asserts that disability results from the interaction between persons with physical, mental, intellectual, or sensory impairments and attitudinal and environmental barriers that hinder full and effective participation in society on an equal basis with others. So this really represents a paradigm shift from viewing disability as a medical problem that needs to be fixed or an issue of charity that requires handouts. And so instead we recognize that society creates barriers that limits participation of persons with disabilities in aspects such as life, such as education, which is what we'll be talking about today. So the social model of disability, which comes from the disability rights movement, says by removing these barriers, people with disabilities will have access and be included. So for one example is a child with a wheelchair may have difficulties with school, not because of the wheelchair, but because environmental barriers navigating school premises, such as inaccessible wash facilities or classrooms with steps. So the child's physical disability is not the problem, the inaccessible physical environment is the problem. So adopting a social model on disability presents us with an opportunity for more inclusive programming. And when we begin to identify these societal barriers around us environmental, attitudinal, and policy related, we can respond with programming that works to remove them. So there's no need to fix a person with a disability. There's a need to create a more enabling environment for all. All right, next slide. Great, thank you. So this infographic was developed by the GLAD Network's Inclusive Education Working Group, which USAID is a part of. It's also part of the Disability Inclusive Education online module that USAID developed. And if you haven't taken it yet, we highly recommend it. And we can also pop in a link to that in the chat box. So Odala and I, for this presentation, are going to run through the different elements that are considered key ingredients for inclusive education. Next slide, please. Great, so ensure accessibility of physical and communication environments in schools and transport. So for example, having a teacher and peers to communicate with in sign language is important for learners who are deaf or hard of hearing. Learners who are low vision or blind may also require more work and storage space for books and equipment because Braille books are bigger than typical textbooks. Accessibility in terms of transportation to school is especially important if there are inaccessible roads for someone with a wheelchair or crutches. And physical requirements for the use of bathrooms at schools needs to be considered. So in terms of communication, for example, in our Reading for All program in Nepal, we'll be providing refresher training to resource class teachers of students that are deaf or blind, as some of these teachers haven't received training for 15 years, and in fact, lack an efficient level of reading Braille or proficiency in Nepal Sign Language, which can then affect the learning outcomes of their students. Next slide, please. All right, train teachers to use a universal design for learning and curriculum development and the classroom. So UDL is a set of principles for curriculum development that gives all individuals equal opportunities to learn. It provides a blueprint for creating instructional goals, methods, materials, and assessments that work for everyone. Not a one-size-fits-all solution, but rather flexible approaches that can be customized and adjusted for individual needs. So this isn't just good for children with disabilities, but benefits all children in the classroom. Next slide, please. All right, individualized support services and reasonable accommodation. So examples of reasonable accommodation include providing extra time for an assessment, providing a handout in large print, allowing answers to be dictated to a scribe, wheelchair ramps, and so on. In terms of individualized support services, our program in Nepal will be working with teachers to use IEPs, which can then help determine what types of supports or accommodation a student may need to reach their full potential. Next slide, please. So ensure learning materials for different modes or representation and communication. So I've already provided some examples of different modes of communication. Learning materials that would best support some learners with learning disabilities would include hands-on materials and computer-assisted technology rather than worksheets or textbooks, which would allow learners to increase font size, select preferred color contrast, and listen to text-to-audio, text-to-speech audio. So these visual instructions and materials that support the curricula visually, such as presenting a word in print alongside a picture to increase vocabulary, would help create a supportive learning environment. So in our Reading for All program, for example, we'll be supporting schools with tactile learning materials, sentence starters, picture cards, game cards, and so on. All right, Odala, over to you. Odala, are you on mute?
Thank you, Laura. For effective implementation of inclusive education, there's need for engagement of disability movements in the planning, implementation, and evaluation of inclusive education. In this case, we are talking about the DPOs that are working in the inclusive sector. And in Malawi, we have a Federation of Disability Organizations in Malawi. This is an umbrella body of all DPOs in Malawi. And these are involved in the planning of education activities, implementation, as well as evaluation. In the Reading for All Malawi, these have been working closely with the most Minister of Education partners in the development of instructional materials, as well as the adaptation of EGRA instruments for blind and low vision, learning disabilities, as well as those with deaf and hard of hearing. So these have been part and parcel in the implementation of the program and the education sector at large. Next slide. So to have this effectively implemented at the macro level, there's need for inclusive education sector plans and budgets, and this calls upon the Ministry of Education when they are developing the National Education Sector Implementation Plan. These stakeholders are involved to ensure that all needs and aspirations of children with various disabilities are included in the budgets, as well as the allocation of resources, and these have to correspond to the sustainable development goals, as well as the MGDSs. Next slide. In the implementation of inclusive education, all sectors are involved, as already indicated, in the implementation of the plan. In this case, I'm looking at both the private sector, the public sector, the donors, the CSOs, who are the civil society organizations, as well as the Ministry of Health in the implementation of the program, because for early identification, the Ministry of Health has to come in to provide that necessary assessment of children with disabilities. And also in the teacher education, they are incorporated in ensuring that whatever is taught is included, is inclusive of aspirations of children with disabilities. Next slide. So parents and community leaders and also the caregivers are essential in the sense that there's need for raising awareness on the rights and the benefits of inclusive education. It becomes very important for parents to know that their children, despite having a disability, they are able to participate equitably with other fellow learners. So they need to be sensitized on the need to send them to school and provide them with all the necessary resources. Otherwise, without the sensitization, most of the children are left at home because they don't know the value that the child will bring to the family. So the sensitization meetings are essential in this case. And with the collaboration of PODCAM, we've got Parents of Disabled Children Association of Malawi. They mobilize the parents and the community to see that children with disabilities are sent to school. Next slide, please. So in the quest to ensure effective and successful inclusive education, partnerships are important in the sector. That is, the community leaders to take the leading role in ensuring that all children are going to school. There's none who is out of school, and the private sector providing the necessary support. And in this case, we have seen the private sector coming in Malawi, providing the teaching and learning materials. And also we have there's an annual event that is organized by the minister and the Reading for All Malawi and other organizations to showcase the best practices in reading among the blind and low vision students, as well as those that are deaf or hard of hearing. So this is an encouraging aspect that is inclusive education should cut across all sectors to ensure it is sustainable and it is bearing the fruits. So at the end of the day, the children with disabilities are excelling at the level with their counterparts. Next slide. So this is what we wanted just to share with you as far as key ingredients of inclusive education is concerned. And this is now the time for the comments and questions that you may have. I will open the floor for questions. You may open up the chat window to ask questions, or you may raise up the hand to have the floor. Over.
Great, thanks, Odala. Also, if you want to speak, you can always type raise hand in the chat box, and that way you can turn on your mic and even your video in case you want to speak verbally. So thanks. We've just provided a brief overview of disability inclusive education, as Odala noted. But as you saw, there were a lot of key ingredients, and these things are not easy to achieve. And so we've touched on some of the aspects from our program in Malawi and Nepal, but we'd be happy to talk a bit more about our programs or just challenges we've been facing, or really address any of the questions you had. So let's start to look at some of the questions. It looks like we have a question from Kelsey. She's asking, knowing now what you know, is there anything you'd go back in time to tell your past self to change regarding programming for disability inclusive education? So that's from Kelsey. Odala, do you want to take a first stab at that?
Sure. Yes, in the programming of inclusive education, obviously, I think there's need for revisiting the teacher preparation to ensure that teachers that are graduating from the pre-service, they are well versed with pedagogy and strategies to support children with disabilities. What we've noted that there are just some basic knowledge on how to identify students with disabilities and how to support them, but they are not providing adequate information regarding those students that are deaf or hard of hearing, and also other intellectual disabilities, how to help those students to acquire effective reading skills or learning outcomes. And in the team, maybe we'll have other colleagues from Malawi. They may chime in to highlight what the situation in Malawi. Thanks.
Great. I'll just respond in terms of if I could talk to my earlier self during the program design process or when we started this project. I think one of the challenges is getting the different ministries to work together, especially the health ministry, the education ministry. We have a ministry of women, children, and social welfare, and they work on the disability cards. And it can be challenging to bring all the different actors to the table. And so when we designed this activity, we initially had plans to work on and test screening tools for screening within schools, and then provide referrals to clinics or medical experts. The challenge is there's not enough medical clinics available, or it's too costly for parents to send their children to medical clinics if they need that type of referral. And so I think planning to build a stronger partnership in the design with the Ministry of Health and with health actors is something that I would have gone back to my earlier self in this design to look back on. I think that's one of the things that I've learned through this process so far. So let's see what other questions are out there. Okay, it looks like we had a question relating to data. So Rikita, I don't know if I'm saying that name right, but what challenges and successes have you found in relation to collecting data? Odala, do you want to respond to that first?
Yes, in Malawi, I think we have challenges in getting inclusive education data, in the sense that the current EMIT education management information system tools, they have not captured much of the information that we would want to, especially the prevalence of various students with disabilities, and also the data that is collected is a year behind. So obviously, we may not have real-time data collection, but at the moment, there's a revision to the EMIS data tools that will be used to ensure all categories of students with disabilities are recorded, and their data is uploaded right away from the schools where the students are to the headquarters at the ministry level. Over.
Thanks, Odala. And just from our perspective, I think, yeah, data can be tricky because we want more data on disabilities. There's a lack of data, right? But also when we start to get data, so when we go through these screening processes at the school, we want to align with a do no harm approach. So we don't want to label kids and any potential negative consequences that could happen through a preliminary screening process. And so collecting data is important. And one of the things that the Reading for All project in Nepal has been working on is on a subsystem to the national EMIS system to collect data on children with disabilities, but not just the screening process, but even further trying to track the child's education support that they're getting through the teacher. So if there is a child that has been screened, what kind of functional limitation they may have, and then what adaptations may the teacher need to make in terms of pedagogy for this child, and then has the teacher taken that on. So it's also to try and track the educational support that the teachers are providing to students once they've been screened. So we're really excited about that. We just, we're in consultation right now with the ministry. So that's some ongoing work that our program is doing. So let's take a look at the next question. So there's a question from Leonardo or a comment that says parents and communities are to hold the service providers accountable to quality inclusive education. Odala, do you have anything to say about that comment?
Yes, of course. In Malawi, the parents obviously are in a way reluctant to ensure that their students are getting quality teaching and learning because the environment is not conducive to their children's learning, because some of them require support from the parents. So the schools, some of the schools are in a way not conducive to some of those students with disabilities. So there is need for reformation of institutions to ensure that every child is accommodated. There is accessibility for every child. So the government and the partners in the inclusive education have to see to that every child is accorded the rights to education. Thank you.
Yeah, thank you. I think that's an interesting comment. And what I think is hard is because, in terms of equality, inclusive education, the teachers don't necessarily have the resources or the knowledge in order to teach inclusive education. So it's challenging. And we recently did a CAP study on inclusive education in Nepal. It's a small sample size. But and there were some instances where the schools were blaming the parents for not teaching their kids how to read, and then the parents were blaming the schools on not teaching their kids how to read. So it's kind of a blame game. But in the end, the schools nor the parents were equipped with the resources and tools to help their children with disabilities learn how to read. So that was just something that I thought of when I saw your comment, Leonardo. So thank you for that. And then we have a comment from Joe asking if we consider trauma a disability. Odala, do you have a comment on that?
Sure. Yes, of course. This is part of the it's a disability because it affects the child's concentration at the school. Because if the child is always not attentive, obviously learning gains will not be acquired, and also the teachers may find it difficult for the child to understand the concept as being presented. So it is also a requirement that the teachers need to have time with the student and understand the challenges that the child is facing, especially those that are from conflict areas. They may be traumatized, they may not concentrate, they may be having nightmares of some kind. So they also need to be part and parcel of the inclusive education sector, and the teachers and the school management has to see to that these children are also given psychosocial support for them to learn effectively. Over to you.
Great, thank you. I also wanted to see Josh Josa. Did you want to comment on that question as well? Okay, we can come back to that. Anyways, Josh, if you're on and you want to comment on that, please go ahead. Let's see what the next question we have is. So there's a question from Parashu. I'm sorry if I'm not pronouncing that right, asking, can we get data related to inclusive education for Nepal and Malawi? Odala, do you want to speak on the Malawi part?
Yes, of course. We may have this data in in Malawi as far as inclusive education, and as already indicated earlier on that there's improved tools to ensure all students with disabilities are recorded in the system. And at the moment, the Reading for All Malawi with other national reading program partners are working to rectify that. Of course, at the moment, we have the data that is being that was corrected previously, so it's available. But we are doing an update to the data sets. Over to you.
Great, thanks. So let's look at another question. I think we have some questions related to the COVID-19 operating context that we're working in. There's a question from Freddie asking, inclusive education becoming a serious challenge in this difficult time of COVID-19. Any recommendation on how to help students in times of uncertainties like this? Odala, do you want to take that first, and then I can answer on the Nepal front?
Thank you so much. I think the COVID-19, I think has brought in a paradigm shift in the way we implement inclusive education. What has been noted is that I think quite a number of students with disabilities were left behind, because when the schools closed, I think there wasn't any kind of follow-up to how they are faring, what sort of messaging is going out to them. But with the establishment of inclusive education technical working groups with the Ministry of Education and other players, the UNICEF, Save the Children, and the Royal Norwegian Embassy, they are coming up with the ways on how to support these children with disabilities through COVID. The Reading for All Malawi has set up a WhatsApp group with the specialist teachers, the DPOs, as well as reaching out to parents in the current scenario. However, for them to access the materials, it's been a challenge. So the cluster committee on education that is overseeing COVID, continued learning during COVID, they are looking at ways to circumvent this. But it has been a paradigm shift and an eye opener at the case for Malawi. Over to you.
Great, thanks. And in terms of Nepal, we're working closely with the government, donors, and other stakeholders in terms of how to continue education in times of COVID. Specifically, what the Reading for All project is doing is working on a sign language app for introducing vocabulary, words, and comprehension. And that, while that is really important, and we're really excited about that, we know it'll only reach a certain amount of the population. So we haven't distributed anything anything in person, but we are working on electronic information that's available electronically, and support with putting the curriculum and supplementary reading materials online. So we are supporting the online available materials. And in terms of at the local level, there are, I think, 14,000 learning packs that have been distributed by municipalities to students in their area. All right, next question. Oh, Josh, I think you did have something to add on this question, right? Do you want to go ahead?
Yes, I just want to add, sorry, just getting set up with the interpreter. I just want to add on to that at USAID, we are doing a lit review for reasonable accommodations during COVID-19 for distance learning. So I can put a link into the chat, and it'll show the different modalities that we have. We have print and paper, through the phone, texting, for example, television, radio, lots of different tools and programs, and it's all equity-based lens. It's coming through an equity-based lens. So we have some examples of reasonable accommodations for learners with disabilities through distance learning. And we're trying to encourage the ministries and the governments to think about all of those different types of students in trying to promote universal design for learning within the design for the learning materials. And we can see a heavy design that's dependent on radio-based learning, but we are trying to expand that portfolio and toolbox as we are facing the challenges right now with handling the pandemic, and then also continuing developing our work in the inclusive education sector. So I'll put that link in the chat.
Great, thank you, Josh. Let's go to another question. So Meal asks, how influential are the community leaders in implementing inclusive education? Odala, do you want to answer that?
Yes, in the case of Malawi, the community leaders are very influential in the sense that they are like the agents of change in the community to see that the children in the community have quality education. So every child has to go to school. Those that are of school going age, they should go to school. And the children with disabilities should not be left aside, because if they are not educated, they will have difficulties in sustaining their livelihoods, and also it may pose a burden to the parents. So in this case, the community leaders are coming in to ensure that the children are sent to school. So they are part and parcel of the working group within the community to see that everyone is accorded the right to education. And in this case, there have been sensitization meetings that have been carried out through various DPOs to ensure that role models are brought to the communities, to ensure that a child who has a disability can excel in school. And we have got living examples in Malawi where we had, I think, a director in education as one of the blind profession. So these have to be the mouthpiece of those students in the homes that have not been sent to school by the parents. So the community leaders have a role to play. Thank you. Thank you, Aurora.
Yeah, I completely agree with that. And I think attitudes play a big role in terms of ensuring inclusive education. Let's go on to another question from Patricia. She says, I would like to hear more about the programs. It would be great to hear more about the lessons learned from the Malawi and Nepal programs. Odala, do you want to start with sharing any other lessons learned from Malawi?
Yes, in Malawi, the Reading for All Malawi, I think is a program that is really looking at inclusive education among the area grades. And we have seen that with the implementation of this program, there are a number of awareness building that is being made, whereby the DPOs were mapped together, networked, to ensure there is continuity of efforts that were there, and ensuring all the departments of the Ministry of Education are aware of issues to do with inclusive education, More especially, the Department of Special Needs Education is housed at the ministry to see to it that all issues of inclusive education, from the primary to secondary to higher education, they are all taken on board. And one important element is also the issue of Malawi Sign Language. We didn't have the formal dictionary to guide the teachers on what sort of sign language to use effectively and communicate effectively with various partners or various teachers or practitioners. There has been a gap in Malawi Sign Language, and with the coming of Reading for All Malawi, there was an adaptation of Malawi Sign Language EGRA, which was conducted and has never been done before, and also the development of EGRA for the blind and low vision, as well as the learning disabilities, and also the bringing together of all players in inclusive education, because we have Save the Children have got their own component of inclusive education. UNICEF is supporting, the Royal Norwegian Embassy, and many other programs. So the coming in of Reading for All Malawi is bringing together these players to ensure that the inclusive education is a concerted effort, and the ministry is in the forefront to ensure that their allocation of resources to the inclusive education across the sector, and the coming in of various donors and the partners, especially the private sector. They are forthcoming in providing the necessary support, as long as there are plans that are clearly stipulating what benefits the students would have after going through education. Apart from highlighting the need for having real-time data on the ground. Over to you. Thank you.
Great, thanks. I just want to share another lesson learned, at least that I've had. I think, you know, when we designed the Reading for All Nepal, we maybe should have allowed more time for testing of tools, especially for screening tools. So we're using the child functioning module that the Washington group developed, and it's meant to be used as a census survey, but we're using it for teachers in classrooms. So we've done some pre-testing around that, but I do think, and that's what we're moving forward with using, but I think it would be good to allow more time for pre-testing of the tools so that we could continue adapting the training for how teachers and head teachers should be using that screening tool to make sure it's as effective as possible. So I think screening's tough. Ideally, you know, you want to have children screened at an early age, first on vision and hearing, but in Nepal, it's just not consistent. And so we've started with this child functioning module, which is quite comprehensive, but I think allowing more time to really refine the tool and refine the training for use of the tool would have been good. So that's just one of my reflections on the project. All right, let's see what other questions we have. Let's see, so there's a good question from Jerry here. Most of the examples given so far related to students with sensory or mobility issues. Do your interventions address the needs of children with intellectual and/or developmental disabilities, as these are more prevalent? Odala, do you want to speak on behalf of your project?
Of course, we are looking at inclusive education that takes care of the needs of various categories of disabilities, and these students with intellectual or developmental disabilities are also part and parcel of the program, because the Reading for All Malawi is developing the UDL toolkits that will be supporting various students with disabilities, and also teachers are prepared on how to support these students. And in Malawi, we have colleges where students with specialist teachers are trained on how to support various students with disabilities. Like we have got Montfort College, Special Needs College, and also there's another college that is being established soon. So we are looking at that as part and parcel of our programming, but of course we are ensuring that the resources to support these students are readily available, and teachers are prepared to do that. And we want to run away from the school, the notion of having segregated sort of schools, because we still have special schools in Malawi where we find students with severe categories of disabilities are in a residential school. So we want to make sure that every child is included in the mainstream school. That's why this is part and parcel of our programming as we move on. And my colleagues from Reading for All Malawi are here. They can also shed more light on that one. Thank you.
Great, thanks for your perspective on that. And I think there's someone named Mahmoud from Nigeria who wanted to make a contribution. Are you still with us, Mahmoud? All right. Does it sound like, so maybe Kwahraman, I'm so sorry if I'm not pronouncing your name correctly. Do you want to ask a question verbally? If so, go ahead.
Hi, everyone. I'm Karaman. I'm doing my PhD in education. One of my papers talks about children with disabilities. I was wondering that if the prevalence of disability is higher in those areas where there are mines due to civil war or due to conflict between two actors in Malawi or Nepal.
Great, interesting question. Thank you for the question. Odala, do you want to first respond for Malawi? And if I don't know if Seema or Helen knows, I actually don't have the answer to this question for Nepal, but some of my Nepal colleagues are in the call today. So if you guys want to or can respond to that question, that would be great. Odala, do you have a response to that question for Malawi?
Yeah, what I can say, I think in Malawi, I think there are not many of the students that are affected by the mines, especially those in the bordering borders of Malawi and Mozambique and the other Tanzania. So I think during the civil war, I think there are quite a number of the students that were affected, but at the moment we don't have really much data on that one, as we are trying to ensure that all students with such kind of disabilities are recorded and the data is available. That's what I can say. Thank you.
Great, thanks. So unless any of my Nepal colleagues want to come on.
Hi, Laura.
Hey, Jaya.
This is Jay from Nepal, USAID Nepal. So basically, I don't think we have data related to the number of children affected by mines. As you know, our industry here in Nepal is not much. So basically, we are agriculture-oriented economy, and then mostly in service sector, not so much in the industrial arena. So I doubt we have so much effect due to mines, but the children with disabilities could have resulted from different other factors.
Great, thank you so much, Jaya. So let's see what other questions we have. Let's see, we have a question from Joe asking, funding for these services can be very expensive. How do you provide services to rural communities without sufficient means? Do you have examples? Odala, do you want to go first?
Yeah, that's a good question for Malawi. I think the program is just hitting the ground. We obviously we look at what has already been provided for by the ministry and other donors in the system. What they ensure is that all assistive devices are readily available to all students, because as I indicated in my previous response, that the Department of Special Needs Education has an allocation of funds to support the students in rural areas. That is ensuring the teaching and learning materials are available and also assistive devices are available. So with this data and the coming of UNICEF, Save the Children, they also look at that those challenges and provide the necessary support to the rural community, since the ministry has got data of these students and their location. And through the network of parents of disabled children association of Malawi and the FEDOMA, they have a network that sees that all students that are in school are provided with the necessary resources, and also meeting their parents, because the parents have got their own network to communicate whatever issues they are affecting them. Over to you. Thank you.
Yeah, and I'll just make a comment in terms of services. I think so. I think some services or some parts of inclusive education are quite low cost in terms of if you have a child with a hearing impairment or who's hard of hearing and is sitting in the back of the classroom, you simply want to move them into the front of the classroom. So I think the investment on that is to train teachers on pedagogies for inclusive education and how to adapt their teaching for children with different functional limitations. So I think some of the things that teachers can use are actually quite low cost, but there are some yes, initial costs such as trainings or Braille machines are a bit more costly, but there are low cost ways to do these things. So I just wanted to make a small comment on that front. Thanks. Okay, let's go to our next questions. Let's see.
I think the next question on the from Sylvia Cabas, talking about how to ensure quality control and adherence standards for inclusive education in Malawi. I think especially pertaining to the washrooms and pit latrines. Of course, the ministry has in place the Department of Inspectorate and Advisory Services that looks at the infrastructure and also the teaching and learning. However, I think there are some latrines or toilets that are constructed by the rural communities. So if the rural communities are not sensitized on the requirements or the standards to be looked at, I think obviously we have the mismatch. So with the inclusive education on board, we are making sure that all institutions, facilities, they are accessible to all students with disabilities, and they are of the right size, with having some rails and even those that can handle when they are accessing them. So I think that's something that Malawi is undertaking to ensure every child has got good access to the facilities and that are not posing a risk to them. Thanks.
Great, thank you. Let's go to the next question from Patrick. An important element of the social model is a transition away from a sole focus on diagnosis of the disability to understanding what difficulty a child has with interacting with and being included in learning. What rubrics or assessment tools have you found that help teachers or school leaders do this well and importantly, simply?
Yeah, I think let me take on that one, Laura. As far as the Reading for All Malawi is concerned, they are working on the revising of the toolkits that are supposed to be adhered to by the schools, and currently there is one that is under review, and we are hoping that it corresponds to the standards that are required to make sure that the students are provided with all the necessary resources. They are not just put in a school, but they are acquiring effective teaching and learning. So some of the aspects to be included are those the checklists that have to be that have to be scored for a school to say, oh, this school is really on the right path to inclusion, because there's still room for sensitization with the school leadership as well as teachers on how best to have that record in place. Over to you. Or maybe I have, there's Betty on the call. Betty Wisik from Malawi Reform can chip in on that one. Are you here, Betty?
Yes, I'm here, Odala. Thank you. So I'll just comment, I think, on some issues pertaining to what has been discussed already. The first one I wanted to add on the most like causes of disabilities, as Odala has already said. So this is just in addition. I think Malawi, as other countries in the sub-Saharan Africa, we have a high prevalence rate of malaria. So most of the disabilities are caused because of that disease. And most learners or most people who are deaf or those with learning disabilities, it's because they're attacked by malaria and maybe the treatment wasn't like given to them in good time and they end up acquiring the disability. There is also an issue that was raised pertaining to the issue of communication, like sign language. In Malawi, we still have a system whereby we have special schools for learners who are deaf and hard of hearing, and the mainstream schools where learners who are deaf and hard of hearing also attend. And also the learners who are blind and low vision, they also go to special resource centers or specialized resource centers, whereby the only blind learners attached to that particular center, while others attend to mainstream schools. So this is really a challenge on the ground, because if you go to mainstream schools, most of the teachers there are not really trained on how best they could support these learners. And in the end, most of the learners who are attending special schools are not very much assisted as compared to those who attend specialized institutions like special schools. So for now, like in Malawi, if you talk of one sign language, it's a language which is still developing and there are a lot of gaps on the ground. It needs to be really like developed and make sure that teachers are able to use it fluently and be able to support the learners. And this needs a lot of time, because as any other language, there is need for research to document the dictionary and make sure that the language is standardized and teachers are trained fluently on how to use this particular language. And I also saw a certain question about sign language interpreters. Someone has asked on the comment box, how are we working on this particular area? I think speaking on Malawi, there is a very big challenge, because as of now, we only have less than 10 professional interpreters nationwide against a population of over 500,000 deaf people. And it's really difficult for us to send these 10 to all the mainstream schools and support the learners and ensure that effective learning is taking place in the mainstream schools. So there is need to train more professional interpreters, as well as to make sure that the language is fully developed and used by the teachers, so that whenever they're teaching and supporting these learners, they're able to support them effectively. So I think we still have an uphill battle to accomplish in order to ensure that learning is taking place effectively, especially to learners with sensory impairments, especially the deaf and the blind. Thank you.
Thank you so much.
Sorry.
Okay,
I wanted to give Seema from the Reading for All project to respond as well to that. It looks like Patrick's asking, instead of a medical diagnosis focus, how do we give teachers simple ways to identify the nature and degree of functional limitation? Do you have simple, basic, and easy to use examples? Seema, if you wanted to share what you're working on here in the Reading for All project, we're working on an educational response system to the screening. Do you want to jump in on that?
Hi, everybody. Laura, if I hear correctly, so I'm going to share about how Reading for All Nepal is, so working on education response system. Based on the early screening, so children after, so identified with the different type of limitations. So children, if the children require for the further second level assessment to confirm whether he or she has a disability or not. And then similarly, student may need the education support, or they may need extra check or health checkup. Based on that, so the education response system, we are responding from first at the school base screening, then second phase screening, and then referral, and then the schools at the mainstream school. Teachers will receive the training in special pedagogy, how to deal with the children having a different type of learning difficulties or disabilities. And so how many teachers you need to use IEP, education individualized education plan for the particular children. So this is how the response system, under the response system we are working. And for the issues we are also find out, so it's same like as Malawi. We have a language issue here in Nepal also, even in the sign language. We have a different dialect. So within the country, the government is trying to establish, Nepali sign language. But it's earlier discussion. Teachers who are teaching at the special school and resource classes are so not updated on the sign language, and so they student are a lack of vocabulary. They have a limited vocabulary. This is the situation. Thank you, Laura.
Great, thank you so much, Seema. So it looks like we're out of time. And Odal and I just want to thank you for participating. But first, there's a evaluation form we'd like to ask you to fill out. So that should be popped up in the chat box shortly. If someone can pop that in there. I'm just asking you to fill out that evaluation form. That would be really helpful. Thank you so much. So just from my end, thank you so much for participating. I think given all the questions and comments, there's a lot more discussions that need to be had around this really important topic. Odala, do you want to say any last words?
Yeah, I just want to thank you all so much for your participation in this webinar. I would like to appreciate your contributions, and this will help in the programming and implementation of inclusive education. And I know you may have a couple of questions that will need answers for. I think you can circle back to us so that we can provide those responses, especially from the Malawi perspective on Reading for All Malawi. And we also have the National Reading Program, which is also part and parcel of the education sector. So we'll be comfortable to share with you. Thank you so much. Looking forward to meeting you next time. Thank you.
Thank you all so much. Have a lovely day or evening.